Welcome back, Mary Rose. My name is Dr. Luna, and I'll be doing your assessment today. So I see that you booked an appointment because you have some concerns that have started in the last couple of days. Tell me what's going on.
It's a few things. So I guess starting off, I've been having headaches for a few months now.
Okay.
But in the past few days, I've had some tingling, pins and needles in the back of my head.
Okay.
And also some back pain.
Okay. Pins and needles in the back of your head. Is it localized on the scalp?
Yes.
Okay. Just checking for any lumps or any bumps. I'm not feeling anything. Do these sensations radiate down the spine?
A little bit.
Okay. Several pins and needles in the back of the head radiating down the spine. When did these sensations begin? You said a couple of days. Were you doing anything in particular when that started?
I woke up that morning thinking maybe I had just slept wrong.
Okay, so maybe body position. Are you usually a side sleeper or do you sleep on your back? How do you usually sleep?
Either on my side or on my stomach.
Okay. This video is sponsored by Babbel, one of the top language learning apps in the world today. I chose Babbel because I want to work on my self-improvement. I'm also interested in travel. Learning a new language is a wonderful and fun way to stimulate your brain and challenge yourself. I chose French and I started seeing results in about 3 weeks. Scientifically proven by researchers at Yale University, Michigan State, and other major institutions, Babbel will also help you start speaking a new language in just 3 weeks. The lessons that I've took so easily on my phone, my tablet, or my laptop have prepared me to have real-life conversations on travel, business, and really any topic that interests me. I found Babbel to be more like a language coach, guiding me towards conversations that felt natural and fun. Je voudrais voir la Tour Eiffel. Now that I can speak a little French, I'm actually considering visiting Paris this summer. Babbel is every explorer's must-have travel accessory for a reason. It's simple, bite-sized lessons give you the confidence to speak a new language wherever you go. See the world, then stop to say hello. You too can start speaking a new language in 3 weeks with Babbel today. Which language would you like to learn and why? Drop me a comment down below. I read all of them, I promise. Salut, tu connais Paris? Non, je ne connais Paris pas.
Non. Tu veux un croissant?
You can use the app on your phone just as easily as you can see me using it here on my laptop. Click in the link in the description down below and get 67% off your subscription. Babbel is having a Memorial Day sale, so between now and June 2nd, you can get up to 67% off your subscription. Don't miss out. Thank you, Babbel, for sponsoring this video. Scale of 1 to 10, how intense are the headaches?
I'd say the headaches are maybe a 5.
Any blurred vision or double vision, tinnitus?
No.
During the headaches?
No.
Okay, good. Is your back affected in any way when you feel the pins and needles?
Sort of general back pain.
General back pain, okay. Have you taken up any new activity in the last couple of months?
Not that I can think of.
Are you working out regularly?
I try to.
Okay. How many times a week would you say you're working out?
Maybe 5.
5 times. Okay. And what kind of workouts do you do?
It depends. I like biking, I like swimming, and sometimes I lift weights.
Okay. So both cardio and strength training. Okay. Are you on any medication?
Yes.
Okay, tell me about that.
I take a statin for my cholesterol.
Oh, okay. You have high cholesterol?
Yes.
Okay, when did you find that out?
I think it's been about a year now.
A year, okay. And do you remember the level of your cholesterol? What
Yes.
number was it?
I think it was 122.
122 for LDL.
LDL.
Okay. That is the bad cholesterol that can go over 120, which is above optimal levels. Okay. Other than the statin, are you on anything else?
Occasionally I'll take an over-the-counter, like an Aleve or something for a headache if it gets really bad.
Okay. And when you do take the painkiller, does the headache go away?
Usually, yes.
Okay, so it responds to the painkiller. That is good news. Okay. So I'm gonna go ahead and put on my medical gloves and begin the assessment. Oh, they're there. Okay. Are you on any pain right now?
No.
Any dizziness, anything that's bothering you right now?
No.
And do you feel the pins and needles?
A little bit.
A little bit, good. So I'm gonna get a chance to evaluate them during an active flare-up. All right. Let me go ahead and just palpate your head first. Is it okay if I remove the headband? Okay. There you go. Oops. Gonna set that aside. And just going to feel your head first for overall symmetry. And check for any lumps or bumps. Okay, I do feel you have a mole in the back of your head. Have you had that since birth?
Yes.
Okay, it's quite large, so I'm gonna evaluate it. Okay, no lumps or bumps. The head is symmetric. Any pain when I apply pressure?
No.
How about here?
No.
Here?
No.
Here?
No.
Or here?
No.
Good. Okay, I'm gonna go ahead and check your vitals first. Right. So I'll check your heart. Go ahead and breathe normally. I'm hearing S1 and S2, no S3 or S4, so no extra sounds. Good. And no murmurs. Take a deep breath in and out. Good. Lungs are clear. Also gonna check for any bruit on the carotid artery. Okay. No bruit is present. Good. All right. Quickly going to check your pulse and pay attention to the respiration rate. And over on the other side. Check for symmetry. Good. Okay, can you squeeze my hand? Good, perfect. And can you elevate your arms like that? I'm gonna do a couple of strength tests. I want to check the overall integrity of the muscles in the back. I'm going to attempt to push your arms apart. Don't let me do that. Good. I'm going to attempt to lower them. Don't let me do that. Perfect. And can you spread out your fingers for me? Good. I'm going to attempt to bring them together. Don't let me do that. Perfect. Okay, good. Good, perfect. Right, I'm gonna check your cranial nerves. Can you raise your eyebrows for me? Good. And keep them raised. Good. And don't let me push them down. Perfect. And give me a wide smile. Good. And now puff out your cheeks for me. Don't let me unpuff them. Perfect. Now I'm going to attempt to move your head from side to side. Don't let me do that, so resist. Good. Good. I'm going to attempt to bring your head towards the wall. Don't let me do that. Perfect. And I'm going to attempt to push you back. Don't let me do that. Good. So muscles in the back are okay. Lower and upper muscles, cranial nerves are intact. Okay. All right. I'm going to check your eyes. And if you can just look into the distance for me, I'm going to check your pupil response. Good. 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 All right. Perfect. So pupils are normal. I'm gonna go ahead and write this down. Normal pupils. Cranial nerves 1 through 5 are intact. Okay. All right. So let's go ahead and lay down, and I'm going to take a closer look at your head, your scalp, and the back of your spine, and see if I can understand what's going on with you.
Okay.
Okay, Mary Rose, I'm going to check your face, your neck, and your head from this position.
Okay.
I'm going to begin by just palpating the lymph nodes. Starting with the lymph nodes under the jawline. Okay. And the lymph nodes in the front of your ear. And down the neck. Okay. I'm going to do some light tapping next. I'm looking for any neurological responses that may be out of the ordinary. Good. And I'm checking your sinuses for any congestion or inflammation. Maxillary sinuses are okay. Checking the frontal sinuses and the ethmoid and sphenoid sinus. Okay. Good. Right. I'm going to check the top of your head and the scalp. Right. sectioning the hair and looking at the skin, the color and the texture. I'm looking for any redness, any abnormal visual signs of folliculitis, psoriasis, ringworm. The top of the head looks good. I'm not seeing any colors that would cause me to further investigate. Let's check another patch at the top, at the very top. Yeah, looks good. Right, you can stand back up and I'm gonna take a look at the back of your hair, scalp, and just the back. Okay. Okay, Mary Rose, I'm going to take a look at the back of the hair first, and then your neck, cervical spine, and your lower back. And I'm going to start off by just inspecting your scalp again from the back. And I'm looking for any particular abnormal colors like red, purple. Okay. I'm brushing the hair and checking for any excess breakage. I'm not noting that, which is good. Okay. And I am seeing that mole that I mentioned earlier. So it has well-defined margins, one color, not bleeding. Round and slightly raised. Does it hurt?
No.
Okay, that's good. And I'm seeing a little bit of a redness to the right of it on your scalp. Okay, let me take a sample of that and see what's going on with your skin there. Okay, if you can now lower your head just a tiny bit, yes. Perfect. I'm going to just scrape off a little bit of the skin that's above it and around. There's some redness above as well, 2 patches. I'm not noting any dryness, but I will send these to the lab and the samples will be tested for various skin conditions, starting from psoriasis to contact dermatitis and possible genetic disorders as well. Okay. And I'm going to look everywhere else as well and see if there are any other patches of redness on the scalp. Okay, good. So I'm gonna go ahead and tie your hair in a ponytail if that's okay with you, and I'll inspect the spine and the nape and the back.
Okay.
The scalp looks good everywhere else. Okay, just making sure I capture all of this wonderful hair. Okay, good. And it's quite long, so I'm going to just create a bun. Good. Right. Okay. Just palpating the nape. Not feeling any lumps or bumps or anything that may be concerning. Okay, is it okay if I unbutton the gown? Okay. Okay. Just going to do a visual inspection first and look for any obvious deformations or lesions of the skin. I see a couple of raised moles. Have you recently gone to the dermatologist?
No.
Okay. So a couple of them are red, so I would check them out and keep an eye on them to make sure that they don't change shape or color. And if any of them become sore or they start bleeding, I definitely check them out. I'm going to palpate your spine next, and I'm going to start with the cervical spine, thoracic, lumbar, and just work my way down. And I'm feeling C4 and C5. Right now I'm checking for any nodules or any obvious deformations. Okay. D7, D8. Cervical and thoracic spines are straight. And checking the lumbar spine too. Okay. Got no signs of any scoliosis. Now go ahead and listen to your lungs. Go ahead and take a deep breath in and out. Deep breath in and out. Okay, I can breathe normally now. Okay. The lungs are clear. No murmurs, no wheezing. I'm gonna go ahead and perform a couple of sensation tests on the scalp right here and the back of the neck, the nape, as well as your upper back. Okay. I'm going to tap your neck and I want you to count the number of taps that you feel.
Okay. 2, 3, 2, 2, 1.
Okay, how about your back?
2, 2, 1, 3, 3.
Good. Okay. Next up, I'm going to touch you with something cold and I want you to tell me if you feel the sensation more so on the right part of your body or more so on the left side.
Okay. Right. Left. Right. Middle.
That was a trick question.
Left. Right. Left.
Perfect. Right. Now I'm going to attempt to draw a letter on your back. I want you to try to identify it.
A. L. U. C.
Good.
O. X.
Very good. All right, now I'm going to try to push you forward, so don't let me do that. Perfect, and now I'm going to attempt to bring you back. Don't let me do that. Good. Okay. Can you take a deep breath in for me? And out. Very good. And again, deep breath in and out. Checking the expansion of your thoracic cavity. That's very good. Right, I'm going to cause a vibration and I want you to tell me when you stop feeling it.
Okay.
Do you feel it?
Yes. Stopped.
Okay. Do you feel it?
Yes. Stopped. 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 Stopped.
Okay.
Stopped.
Good. Okay. Taking one final look at the scalp here, making sure I'm not missing anything, especially around the mole and the redness that I was able to notice. Okay. And let me evaluate your skin behind the ear here. Okay, that looks good on the other side. Okay. Okay. All right, I'm going to close it back up and we can discuss the results. Okay, Mary Rose, I did a very thorough inspection of the scalp, your hair, the back of your neck, as well as your back muscles. I wasn't able to find anything out of the ordinary. I want you to keep a log, a journal of when you feel those sensations, what you were doing while you're feeling the sensations, and how intense they were on a scale of 1 to 10. And I'm going to send this sample that I took from that irritation in the back of the neck that I was able to spot. I'll send it to the lab and we'll see if there's anything physiologically wrong with you.
Okay.
Okay. Yeah, you can unclip your ponytail. I'm sorry I made a mess of your hair there. Put these back. And do you have any questions for me?
I don't think so, no.
All right. And one last question that I meant to ask you. Are you using any shampoo or conditioner that's special, that has maybe some ingredients that you would not normally find in the over-the-counter product?
I don't think so, no.
Okay. All right, so I'll see you back in a couple of weeks and just make a note of those times when you feel the sensations and we can monitor them.
Okay.